VCS06 Learning Outcome 4, be able to assist with end-of-life care. The aim of this video session are to cover the following. Assessment criteria 4B, explain the end-of-life care process, procedures and client choices. 4C, recognise the need for an ability to show empathy with emotional clients. 4D, explain current legislation and limitations of this in relation to the role and responsibilities of the veterinary practice. And 4E, describe the support required by owners and animals with end-of-life care. Some terminology for you to be aware of. Euthanasia is the act or practice of ending the life of an individual suffering from terminal illness or an incurable condition, as by lethal injection. Bereavement is the action or condition of being bereaved, a period of grief following the death of a person or an animal. Let's consider the following. Why do people have animals as pets? Not all animals will be classed as pets, so think of other reasons that people may own an animal. For example, one type might be a working dog, but there are other reasons that people will have animals that may not be classified as pets. The image in the top right-hand corner might also assist you as well. Have a think about the reasons you have encountered and other reasons for people having animals, and make a mind map of your ideas. Please upload this onto one file for your veterinary educationalist to mark. So, reasons for having animals. They may be as a pet or a companion. A working dog such as a sheepdog or a farm dog. A guard dog. Some animals may be used as status symbols, and there are probably breeds that you might be quite aware of that can be used in this manner. Assistant dogs. So these may assist people that are deaf, blind, may have autism, they may be wheelchair bound, or may have other disabilities. For the elderly or lone persons, generally an animal is a great source of company and tend to be their window to the outside world and also interaction with others. They may also be a family companion. However, please remember that some cultures do not view pets in the same manner as we in the industry do, and have provided you a link there for you to look into this further if you wish to do so. Difficulties in relation to euthanasia. We need to bear in mind that this is an emotional and upsetting time for owners. They may actually have expected the euthanasia to be coming about if it's an animal that's been suffering from a long-term condition, for example, or it may be an emergency due to the patient's condition and situation. The veterinary care team must remain professional at all times, and we must consider culture and beliefs, an individual's feelings and that of a family in relation to euthanasia. There are further difficulties that we may encounter in our veterinary professional role. It may be that we have the request for the euthanasia of a healthy animal due to owner circumstances. Request for a euthanasia of an animal requiring medical treatment to alleviate or cure the condition that due to the owner's circumstances do not want to treat. Destruction of a healthy animal that has been involved in an attack on a child or adult that needs to be euthanized under the Dangerous Dogs Act. Euthanasia of an animal without informed consent due to immediate life-threatening condition, possibly something such as an RTA, that means the patient's suffering must be alleviated and that euthanasia is the most appropriate course of action. Timings of euthanasia appointments. We should consider this first of all, and where possible arrange euthanasia appointments at the end of an appointment schedule. What do you think the reasons are for this? Sometimes emergency euthanasia is necessary, so this needs to be done with the utmost speed to prevent patient suffering, and this means this may take place during a busy appointment session. It's really important to enable clients and owners to have the procedure done with as much privacy as possible. Allow the client to spend time with their pet before and after the procedure without feeling rushed. And owners will be understandably upset, so allowing the client to use an alternative entrance if they do not have to walk through a reception or waiting room full of questionnaires is far more appropriate. And it may be that in relation to your practice that you schedule such euthanasia appointments at the end of your consult session to enable that privacy and time for your clients. It may also be that you have a separate euthanasia room that can be away from the hub of the veterinary practice that will allow for peace and quiet and also enable the client to be able to enter via a different entrance. Preparing the environment. We should take care to provide the owner with an alternative entry and exit to the practice, and as we said, where possible, ideally straight into the consulting room. We should create a clean and tidy and quiet environment to allow a dignified euthanasia to take place. If possible, seating should be provided to allow the client time to sit and spend time with their beloved pet. We may use one consulting room solely for the purpose of euthanasia, or may use more than one, depending on the practice setup. It would be appropriate to provide a small table containing leaflets associated to the loss of your pet and services available to support clients in such upsetting times. Preparing the environment. We should also prepare, where possible, the necessary equipment. Make a list of the equipment that your practice prepares in preparation for euthanasia. Hopefully your list included much of the following equipment: clippers or scissors or both. It may be that the veterinary surgeon requires for sedative drugs to be available depending on the temperament and condition of the patient. The pentobarbital overdose of anaesthesia agent. The appropriate size needle and syringe. Catheter if practice policy or patient condition requires it. If a catheter is to be placed, heparin flush will be required to flush the catheter beforehand to ensure that the catheter itself is patent. A spirit swab to degrease the site of injection. A tourniquet to raise the vein if required and if your practice uses tourniquets. Stethoscope for the vet to confirm that the patient has deceased. The implications of asking for consent and payment for services. Veterinary surgeons and the rest of the veterinary team should keep in mind that events of euthanasia are a highly emotionally charged time. In relation to consent, we must again consider the term informed consent, which we have covered previously. And when we talk about informed consent, this means making sure that the client fully understands the whys and wherefores of what we are going to be doing, and that with the giving of such an injection, that it will mean that their animal will pass away. So the consent should be sought from the owner prior to the procedure taking place. The client must be fully informed of the procedure itself, what will take place, and what to expect before, during and after to understand the full implications. And we must take care with explaining such procedures, making sure that we use layman's terms, but in doing so that the animal understands that putting their animal to sleep is an irreversible sleep that is induced by an overdose of anaesthesia. Implications of asking for consent and payment and services. It is not always possible to seek consent, remember. So, for example, when an animal is suffering, for example, such as following a severe RTA, and contact with an owner cannot be made due to incorrect details or no means of contact or identification. In this situation, the veterinary surgeon must make the call as to put the pet to sleep without consent, according to the Animal Welfare Act and Protection of Animals Act and Code of Conduct for Veterinary Surgeons. If an animal is not euthanized on welfare grounds to prevent suffering, that is actually tantamount to cruelty. The veterinary surgeon must make the correct assessment. They should make a full record of the circumstances that support the decision. Payment. Do you have practice policies in relation to fees? If you're not aware of such policies, ensure that you find out. It will be really important because it may be that it's yourself that's involved with such a situation, and it's important that you follow practice protocol, but also our understanding of the situation as well. And we should inform clients of the fees for euthanasia and any services relating to cremation where possible prior to them coming to the practice, so that again they're fully informed and have that little bit more time to get their head around it all. Methods of euthanasia. What is the most common procedure for euthanasia in small animal patients, do you think? Methods of euthanasia. The most common route that we would utilise in the small animal patient is the cephalic vein in the forelimb. This is because we can easily administer the injectable agent into this site. We must consider the patient's health status and also the quality of their circulation to consider whether this is the most appropriate route, and if not, alternatives can be utilised. The furrow of the vein should be clipped or scissored away carefully to aid visualisation of the vein. The nurse will secure the patient's head and forelimb at the elbow joint to ensure that the patient can't withdraw their limb. The nurse holding the leg places the thumb of the same hand across the dorsum of the limb to occlude the venous blood returning from the leg, causing the vein to distend with blood. The area is cleaned using skin cleanser and then spirit to degrease the area. The vein can be palpated. The needle will then be placed into the vein or into a catheter, if a catheter is to be utilised, and it must be ensured that there is flashback, so we must have blood present in the needle, hub and syringe when we draw back. Once we have confirmed this, then the pentobarbital will be administered, and it will be the veterinary surgeon that will be carrying out this procedure, and there should be a sufficient amount administered for the patient's weight. As the injection is administered intravenously, the overdose of anaesthetic moves throughout the patient's system, ultimately stopping the heart, and how quickly is going to depend on the patient's condition and also circulation. The patient will pass away within minutes of the injection. The veterinary surgeon must confirm that the patient has passed away using a stethoscope and palpation of the pulses to ensure that the patient's heart has stopped. Methods of euthanasia continued. In moribund animals and in very small species, injection may be administered directly into the pleural or peritoneal cavity. This is an alternative method. Not all patients are suited to injections directly into the bloodstream. This may be because they have poor circulation and the vein may have collapsed, making it difficult to penetrate. In older animals, the vein may be very fragile and collapse or leak during the process of injection. Following euthanasia, the client may choose to take their pet home to bury. This can only be the case when pets are not suffering from a zoonotic disease. They may wish to have their pet cremated, and they can arrange this themselves directly through an external company, or they may wish to organise cremation using the animal crematorium that you are associated with. How should we store cadavers? Prior to collection, animals should be stored in sealed yellow plastic sacks, or the appropriate colour as determined by your own waste company. If individual cremation is required, this must be clearly marked on the external sack, and sometimes additional labels or documents are associated to it as well. They must then be stored in a cold store facility to await collection, and you must follow the instructions that the company or practice uses to ensure that the cadavers are appropriately labelled. This image is the BVA Good Practice Guide to Handling Veterinary Waste, and we have the coverage of cadavers included here. As I said, your own cadaver disposal and waste disposal company may be part of the same thing, or they may be separate, and they will give you specific instructions as to the types of packaging that cadavers should be stored in and how we should mark on them what type of cremation is required. A bit of health and safety coverage. We must consider the following points in relation to the handling of cadavers. What PPE is required? safe manual handling and how we should handle cadavers, and risks of incorrect handling. So ideally we should be wearing aprons and gloves to protect ourselves. We should be considering our individual capacity when it comes to handling and make a full assessment of the load, and it may be that for some cadavers that it requires more than one person to handle it and to assist with storage, etc. The risks of incorrect handling could be that you could harm yourselves or others. So it is of utmost importance you make sure that you are capable of carrying the load. Health and safety to clarify. Consider every person's individual capability and make a full assessment of the load. Animals lack rigidity in general, but cadavers may be more rigid and actually a dead weight, and we have concerns about damaging the load too. Our capability varies with age. The injury risk is higher in teenage and older years. Also, in relation to pregnancy, hormonal changes, and for those that are handling such an item for up to 3 months after childbirth. Legislation relevant to the disposal of cadavers. A veterinary surgeon should seek informed consent from the owner, firstly for the euthanasia of the pet, and should explain and gain consent from the owner for their chosen option of disposal, and should ensure that any third party involved in disposal is appropriately licensed, for example, if the animal is to be cremated. Legislation. Animal Byproducts Enforcement England Regulations 2011. The regulations impact upon any person or business generating, using, disposing of, storing, handling or transporting animal byproducts. The link above provides a guidance note relating to legislation guidance. And basically this is the legislation that oversees how we should be appropriately disposing of cadavers. The animal byproducts covers the following: entire bodies or parts of animals, products of animal origin or other products that are not intended for human consumption. This includes pet animals, zoo animals, butcher and slaughterhouse waste to name a few. It categorises risk into 3 categories, and category 1 relates to disposal of pet animals disposal, and this is by incineration. 2 and 3 relate to other disposal that is not relating to pets. Requirements for collection. Cadavers must be collected without undue delay, and this is to prevent risks arising to the public and also animal health. Cadavers must be transported in sealed new packaging or covered leak-proof containers or vehicles, and these containers must be dedicated to such a specific use. Transportation. During transportation, a commercial document or in certain circumstances a health certificate must accompany the animal byproducts. It must record the date with which the material is taken from the premises, a description of the materials, the quantity, weight or volume and the place of origin, the name and address of the transporter and the name and address of the receiver, and its approval or registration number if appropriate, and the approval or registration number of the plant of origin if appropriate too. Such records must be kept for at least 2 years. However, probably a general rule of thumb for many veterinary practices in relation to a lot of paperwork is 2 to 5 years. Registration. Generally speaking, if you are a plant handling animal byproducts, you will need to be registered or approved. This generally applies to low-risk operations, and you may also need to be registered if you transport animal byproducts commercially. Your local animal health office will be able to tell you if your operation or establishment requires a registration to handle such products, and this applies to the companies such as crematoriums that will be removing such waste from our premises. It's vitally important that animal health is made aware of the nature of the operation, the category of the animal byproducts, so for example in relation to pet animal cremation, category 1, and what they will be doing with them. Incinerators. Most incinerators are approved under the Waste Incineration Directive and will be regulated by the Environment Agency or the local authority. Incinerators which incinerate only animal carcasses and nothing else, such as on-farm incinerators for the disposal of fallen stock, are exempt from the Waste Incineration Directive, and incinerators must be approved under regulation. Burial. Burial of pet animals and horses. The UK intends to take advantage of this exemption in regulation, and the burial of pets remains acceptable. Previously, horses could be buried where they were pets, but not in other circumstances. However, regulation now widens this, and Article 19 provides an exemption for the burial of all horses. Burial should take place in accordance with specific requirements. Animal Health's role. The Animal Health is a government agency, and they ensure the following. Animal byproducts must be handled, identified, transported and used or disposed of in accordance with the requirements of the legislation. Most operators will be operating under an approval or a registration from Animal Health. And Animal Health are the main inspection body for premises handling animal byproducts and are responsible for approving plants and can suspend or withdraw the approval if operators are not complying. If they are not complying with the conditions of the regulation or of the approval, or where there is a risk to public or animal health. Other enforcement actions such as serving notices or prosecutions will usually be carried out by local authorities. Where an offence has been committed, an inspector may serve a notice on any person in possession or control of any animal byproduct, requiring that the animal byproducts are disposed of as may be specified in the notice, or serve a notice on the occupier of any premises prohibiting animal byproducts being brought onto the premises, or only prohibiting this in a way specified in the notice. Generally speaking, the local authority as the main enforcement body will serve the notice, but notices may also be served by Animal Health. And this relates to situations where animals aren't being disposed of as they should be, or the procedures that should be taking place aren't taking place in the correct manner. So you will unfortunately hear of cases of where this has occurred before, where people have been paying for their pets to be cremated only to find that they haven't been. And certainly the storage of pet animal bodies that aren't being stored in the correct conditions and aren't being cremated, or as an owner has requested, is certainly potentially dangerous to human health also. So unfortunately there have been some cases of this taking place, and certainly inspectors would inspect the premises and then carry out the relative sanctions due to this. So furthermore, where something is very severe in relation to the handling appropriately of animal byproducts, we can actually have the suspension and or withdrawal of approval. So where an operator is operating under an approval, commits offence, Animal Health also have the power to suspend that approval until such a point as the operator can demonstrate that they can satisfactorily comply with the law again. Prosecution. Serious breaches that are considered to be a threat to public and or animal health may also be punishable by prosecution. So as discussed in previous slides, we have had situations where this has been relevant, and I've provided links that you can utilise for you to look into such situations furthermore if you wish to do so. Who assists the veterinary profession? The Association of Private Pet Cemeteries and Crematoria and the aims of this association are to promote and aid independent companion animal cemeteries and crematoria in the following manner: to promote the use of companion animal facilities to the pet-owning public and veterinary surgeries, to set and maintain a code of practice to ensure a quality of service to pet owners, and to keep abreast of legislation regarding companion animal cemeteries and crematoria. In summary, this video session has covered some of the aspects required of you for Learning Outcome 4. However, there are further tasks for you to complete within the adjoining handout available on your VCS06 unit. Please complete accordingly.